Combining psilocybin and oxytocin, a new frontier for PTSD and depression. Imagine a therapy that could heal the deepest wounds of PTSD and depression, not just by addressing the symptoms, but by transforming the way the brain processes trauma and emotions. Hello, I am Dr. K. Paul Stoller, and some of you know about my work with hyperbaric oxygen in treating PTSD and other brain injuries, and yes, PTSD is a brain injury even without physical trauma. But this video is about oxytocin and psilocybin, the psychedelic compound found in certain mushrooms, which has already been hailed as a breakthrough therapy by the FDA for treatment-resistant depression. Clinical trials at Johns Hopkins, Imperial College London, and NYU show success rates as high as 71%. Now, imagine combining psilocybin with bioidentical oxytocin, the bonding hormone known for promoting trust, emotional connection, and reducing fear. While no research has yet explored this combination, the theoretical synergy could represent a revolutionary approach to mental health treatment. I've written extensively about oxytocin as it has been an important adjunctive therapy for many of the brain-injured patients that came for hyperbaric oxygen therapy. Psilocybin works by binding to serotonin 2A receptors in the brain, increasing neural connectivity and promoting altered states of consciousness. This heightened connectivity allows patients to break free from repetitive negative thought patterns, confront and release suppressed emotions, reframe traumatic memories in a healthier way. Studies show that psilocybin can produce rapid and lasting improvements in mood and anxiety. At Johns Hopkins, a single dose led to significant reductions in depression symptoms, with effects lasting up to 6 months. At Imperial College London, psilocybin therapy outperformed traditional antidepressants in clinical trials. Oxytocin, often called the bonding hormone, plays a crucial role in emotional regulation, trust, and social connection. When released, oxytocin reduces fear and anxiety by dampening activity in the brain's amygdala, promotes emotional openness and empathy, enhances trust and connection in relationships. It doesn't make you fall in love with anyone but without inappropriate fear and anxiety. Now you are open to love. Love and fear are polar opposites. We choose to operate under one paradigm or the other, as they are mutually exclusive. Bioidentical oxytocin, administered as a nasal spray, sublingual troches or injection, has shown promise in reducing symptoms of anxiety and PTSD, and even improving the effectiveness of behavioral therapy. I think it is one of the most profound neuropsychiatric interventions on the planet and a blessing for persistent grief. Combining microdose or low-dose psilocybin and bioidentical oxytocin could create a powerful therapeutic synergy, addressing both the neurological and emotional aspects of PTSD and depression. Here's how the two compounds might complement each other, amplifying emotional connection. Psilocybin often induces profound emotional experiences, but some patients may struggle to fully engage with these emotions due to fear or resistance. Oxytocin's ability to reduce fear and promote trust could help patients feel safer and more connected during a psilocybin protocol, promoting emotional resilience and enhancing social connections. Oxytocin actually helps the brain process, so the more you take it for emotional reasons, the less you need to take it. Now, the effectiveness of this combination may vary depending on individual factors such as genetics, trauma history, and baseline hormone levels. Some people don't even have functional oxytocin receptors, and a dose that works for Jack may not be the right dose for Jill. To explore the potential of combining psilocybin and oxytocin, researchers could conduct preclinical studies to assess safety and efficacy, followed by clinical trials in patients with PTSD and depression. The combination of psilocybin and bioidentical oxytocin represents an exciting frontier in the treatment of PTSD and depression, and works well with hyperbaric oxygen therapy. The theoretical synergy between these two compounds offers a holistic approach to healing, addressing both the neurological and emotional dimensions of trauma. Of course, there is anecdotal experience revealing synergy, but no clinical trials to date. As research into psychedelic therapies continues to expand, exploring innovative combinations like this could unlock new possibilities for those struggling with treatment-resistant mental health conditions. If you are interested in my online webinars, they can be found at KENNETHSTOLLERMD.com. Share this video to spark the conversation. The future of mental health treatment starts with bold ideas. Let's make sure those ideas can be put into practice.